Good afternoon, everyone. My name is Atik Pati. I'm an MD clinical researcher in Department of Neurosurgery at Mayo Clinic. So today here with the MeDecibel, I'm here to point out root problem, root cause, where we all access the medical knowledge. Mary, when she presented her agenda, the pain problem, our problem was at the very bottom because we are the root cause. If we don't have the accessibility of the medical knowledge, reproducibility of the medical knowledge, our industry is not growing because healthcare is a knowledge-driven industry and research is the cornerstone of that. So what's the problem that why are we not able to access the medical literature in like automated way? In the healthcare, the literature is growing at a very fast pace, and we are facing a challenge due to our busy schedule as a clinicians, as a researchers, as a healthcare professionals, not able to stay up to date with the medical advancement, which is in the medical literature, because we are juggling with the demands of the daily work schedule and daily work routine. So that's the biggest challenge, which is causing and also hindering the innovation in the healthcare industry and also bringing high impact clinical studies. So there was another thing what we learned from the COVID-19 that we need more doctors who are scientists, not only doctors. MeDecibel aims to provide a solution, which is a three-pronged solution, which will be available in the format of a web platform, an application that will be available on iOS and also Android, and a tool-based platform, which will be able to integrate in the EMRs and healthcare platform. So it's an Audium, which is a peer-to-peer literature platform where you can listen the audio literature in the audio format, and also you can create the audio literature. The second is the Fidium, which is the AI-based clinical decision tool, which will be recommending the doctors and also healthcare professionals to provide a better care plan for their patients based on the patient symptomatology. MeDecibel is bringing the Spotify, Audible, and scientific discussion or Twitter of the healthcare industry. There's a market size, is overall healthcare industry, and mainly we are focusing on the medical publishing industry. Thank you very much. If you have any questions, please go ahead.
Can you go back a few slides to the three different products you had? So from your perspective as a provider, which one would you prioritize as the most important one that should be your immediate focus?
At the moment, it's the P2P audio literature platform. Because our tool and even algorithm is well defined at the moment, so we can produce the audio literature on massive scale. The biggest challenge we are facing is the licensing by the publishers, because whenever they publish an article, they are taking the copyrights of that. So we are just proceeding with the open access articles, which can be commercially used. So Audium will be the first, and then second will be going towards a connection. And then third will be AI-based tool clinical decision system.
Okay, thank you.
For the audio literature, do you have any evidence that that is specifically the type of solution that researchers are looking for? Is it that they're lacking audio content because that's quicker, more efficient? Like, what's some of the evidence behind?
I don't have the evidence, but I have a validation of the concept what we are talking. So here I could have shared my slide with you guys. You could have read at home, but you wanted to listen to me. Because I'm the person who can summarize it better, what I'm talking about. And we humans listen more than we read on a daily, like day-to-day routine. So that's the validation of what we believe, that in the healthcare industry, medical literature has to be in the audio format.
What is your business model? What's your revenue model? How do you make money with this?
So our business model is also divided based on our three-tier solution. It's with the individual subscription, group subscription for the academia, healthcare institutes, and we are also getting a revenue in the form of the ads of the industry, healthcare industry.